So we'll start with our new topic, that is Ghrudhrasi. The Ghrudhrasi, the word, it is evolved from the term Ghrudram iva syati gacchati. Ghrudram iva syati gacchati. Ghrudra indicates vulture, and syati is throwing action, or a peculiar movement. Gacchati means motion or walk. So the pain in Ghrudhrasi, actually, Ghrudhrasi is a Shula Pradhana Vyadhi. It's a Vataja Nanatmaja Vyadhi, and usually improper sitting postures, continuous overexertion, and jerking movements, then indulging in excess traveling or sports. This can produce some kind of structural abnormality in our spinal cord. And Vata is the prime dosha in the causation of Ghrudhrasi. It gets localized in the Spik and Kati Pradesha. And it can be related to the lumbosacral area where the sciatic nerve root starts. And the pain, it later radiates through the posterior aspect of Uru, Janu, Jangha and Pada. This is the Ghrudhrasi in general. And the term Ghrudhrasi, it has evolved from the term Ghrudra or vulture. Because usually the pain in Ghrudhrasi is like pain similar to when a vulture pierces its beak into the flesh and draws it forcefully. It's a piercing type of pain. And due to that, severe pain, a typical type of gait is also seen in the person. That is slightly tilted towards the affected side with the flexed affected leg and extended other leg. The affected leg will be slightly flexed. And this type of gait, it resembles the gait of a vulture. So that's why the disease is termed Ghrudhrasi. And the synonyms can be told as ringini. That means something which makes the person to creep or crawl, ear pain. Randrini is a weak point or a rupture. Then Radhina, it is a compressing and destroying. So all these are synonyms of Ghrudhrasi. Since this is a Vatika disorder, all the Samprapti and Pururupa etc. all can be related to the Samprapti and general Samprapti and Pururupas of the uh, Vata dosha. So it can be due to Dhatuksha and either or Marga Arodha. And here the prodromal symptoms are also Avikta Lakshanam Tesham Pururupam, that is mild manifestation of the main symptoms, actual symptoms is the Pururupa in case of Vatavyadhi. And when you come to the symptoms, Ashtangra Dekara has mentioned Pashnim Pratyungulinam Ya Kandara Maru Taradida Sati Utshepam Nigrahnadi Grudra Simtam Prajakshate. So this can be used as a definition of Ghrudhrasi also. So he has explained what affects the tendons, that means Pashnim Prati Angulinam Ya Kandara. Kandara is Thula Snayu, that is big tendons of the legs, especially those in the back of the leg. Pashni Prati Angulinam towards the heel and the toes. So all these tendons are affected by Vayu, and it makes the person difficulty in raising his legs. Sakti Utshevam. Sakti Utshevam. The person feels his difficulty in raising his thigh or the leg in general, and that is called as Ghrudhrasi. So now we will elaborate the explanation given by Charaka. Charaka has explained it in detail, including the cause of the pain. That means almost the pathophysiology of the condition. That is Pikpurva Kati Prishta Uru Janu Jankha Padam Kramat. Ghrudhrasi Stamba Ruktode Gruhnadi Spandade Muhu. So he has explained of certain regions through which the pain is radiating, and he started with Svik. Svik can be considered as the buttocks area. It's the posterior muscular part of the Kati Pradesha, and is included under the Pratyankas. It's a sthana of Medas. And the gluteal prominence or the buttock region is the Svik. And the Kati, Shroni, etc. These are synonymous. It's a sthana of Vayu. It's the seat of Apana Vayu, and it has The Trikasandhi, it also forms part of the Shroni Pradesha, and we can correlate with the pelvis or the pelvic region. Then Uru, it is the thigh region, Janu is the knee, Jangha is the lower leg, and Pada is the foot. So this is the course through which the pain radiates. That is Spik-Purva. As per Acharya, the pain initially starts by in Spik Pradesha or the Spik, and also the Kati. Spik-Purva means initially it is the Spik Pradesha followed by Kati. So we can consider the origin of the pain in the lumbosacral region and the buttocks, and it moves downwards through the Prishta Pradesh. It is also Prishta is also a Pratyanga. It can be included in the lumbosacral area, and it runs down to the Prishta, Uru, Janu, Jangha up to the foot, and there is Ghrudhrasi, Stamba, Ruk, Toda, Grihnadi, Spandade, Mahu. These are the symptoms explained. There is Stamba, or the Stamba is Nischalikarna, that is rigidity is present. The Ruk is pain. Toda is also pain, but there's little difference is that Toda is a kind of pricking type of pain. Grihnadi, Spandade, Muhu. There is stiffness and also Spandana. Spandana is Furana or fasciculation or small muscle involuntary movements in the muscles supplied by the sciatic nerve. So by this course we can consider it's a typical radiating pain is suggestive of the sciatic syndrome, and the path he has explained is the path of the sciatic nerve and its branches. Also he has added Vata, Vata Kapha, Tandra, Gaurava, Raujiganvida. So he has explained two types of Gridhrasi. They classified into Vataja Gridhrasi and Vata Kaphaja Gridhrasi. So all these symptoms which I have explained here is the symptom of Vata, and Vata Kaphaja is manifested by Tandra, Gaurava and Arojaka. That is, stupor is present, heaviness is present, and loss of appetite or anorexia is present in Vata Kaphaja. So association of Kapha is present. And lastly, the reference by Madhav Nidana, that is Vatajayam Bhavet Todo, Dehasyabi Pravakrata, Janu Kati Uru Sandhinam Sfuranam Stabdada Prisham, Vata Sleshmodhavayam to Nimittam Vanni Mardavam, Tandra Mukha Praseka, Bhakta Deshas Tadaivacha. So, Acharya has explained Vatajayam Bhavet Toto in Vatika Gridhrasi. So, he has also classified initially itself into two, that is Vatika and Vata Kaphaja Gridhrasi. So, in Vataja Gridhrasi, it's Toda and Dehasyabi Pravakrata. That is, there means there is an irregular shape of body parts, or patient or the person attains an irregular body shape or its gait due to the pain. Janu, Kati, Uru, Sandhinam, Sfuranam. So in all these body parts there will be Spurana and small fasciculations or Stabdada, severe stiffness in case of Vatika Gridhrasi. Then Vata Sleshmo Davaya, it produces Vanni Mardava, poor digestive ability, it causes Tandra or stupor, then Mukha Praseka, salivation and aversion towards food, that is Bhakta Dvesha, that is aversion towards food, that it indicates Agninasha. So these are the references for the description of the disease or the condition Vatajavati called Ghrudhrasi by various acharyas. Now this condition is usually, when seeing the symptoms, it can be usually correlated to the sciatica syndrome, and I'll be explaining about sciatica syndrome in the following slides. So sciatica or sciatic neuritis, it is the radicular pain syndrome of the sciatic nerve. The nerve roots are L4, lumbar 4, 5 and sacral S1, S2 and S3. Usually it is formed by the irritation of the spinal nerve root associated with disc herniation at a level of lumbar 4 and lumbar 5, or lumbar 5 to between lumbar 5 and sacral 1. So pain usually begins in the lower back, radiating to the sacroiliac regions, the buttocks, the thighs, calf and foot. So usually sciatica is a description of symptoms of inflammation or compression of the sciatic nerve. Usually what happens, there is a compression or inflammation of the sciatic nerve. And it's not a diagnosis, it's a description of symptoms, that is sciatica syndrome. So pain will be the most important feature, of course, and it can be associated with muscle weakness or numbness or burning sensation, etc. So it's a group of symptoms. So exertion of a forced movement, usually it results in acute low back pain followed by referral to the leg. So always there is a exertion or a forced movement which results in the acute low back pain of sciatica and followed by referral to the leg. And usually it's exacerbated by standing, sitting or exertion, coughing, sneezing, etc. All this action aggravates the pain, and usually it is relieved by lying down. So now we will come to the causes of sciatica. And mainly, basically, it is of inflammatory causes and due to nerve root compression. Inflammatory in the sense, sciatic neuritis, this inflammation of the sciatic nerve, or arachnoiditis, the condition of the arachnoid matter, or the covering of the spinal cord, it gets inflamed and it can cause radicular pain or radiating pain. So these are the inflammatory reasons for sciatica, and nerve root compression is the major cause. There is compression of the nerve in the vertebral canal by a disc, that means a herniated disc, or a tumor, or a tuberculosis can be a reason. Inflammation by infective tuberculosis, it's a reason for this compression. Then compression in the vertebral foramen. So after the vertebral canal, compression can occur in the vertebral foramen where it runs out, the nerve runs out. So the root canal stenosis because of osteoarthritis. Stenosis means narrowing, narrowing of the root canal. It can be due to bony spurs arising from osteoarthritic conditions. Then spondylolisthesis, that means the slipping of the vertebrae, it can compress the nerve in the intervertebral foramen. Also facet of the vertebrae, the articulating facets of the vertebrae, if it gets inflamed, it can compress. Then any kind of tumor growth occurring in the area, it can compress the nerve in the intervertebral foramen. And later when it runs down, it gets compressed in the buttocks area or in the pelvis by abscess. Then tumors can compress it, or hematoma. Hematoma, it is a collection of blood outside the blood vessels, maybe due to a trauma or a bruise, a contusion, etc. It can cause small veins and capillaries under the skin to break and collect or pool the blood outside the blood vessel, and this hematoma can compress the nerve. So these are the causes in general which can produce sciatica syndrome. Other causes include piriformis syndrome. It's a pseudo sciatic pain. It's not a proper. It can be cannot be considered as a proper sciatic pain, but it's a pseudo sciatic pain. But the origin and the cause is similar. That is piriformis syndrome. That is the neuromuscular syndrome that occurs when the sciatic nerve is compressed or irritated by the piriformis muscle, causing pain, tingling, and numbness in the buttocks along the path of sciatic nerve. So piriformis syndrome, the inflammation in the muscle, it can produce irritation in the nerve. Then vallet sciatica or fat vallet syndrome, that is caused by aggravated by sitting with a large vallet in the affected side's rear pocket. So usually when we keep a big vallet in our back pockets and sit for a prolonged time, it can compress the sciatic nerve running through the buttock region. That is the vallet sciatica or fat vallet syndrome. It's also called as credit card syndrome because due to the increased number of credit cards, the vallet becomes fat and thick, and it can compress the nerve on prolonged sitting in the rear pocket. And other causes include pregnancy, which is due to the increase of weight. It can compress the abdominal pressure. It can compress the nerve roots. Then trauma is also another cause which can produce sciatica. So now we will just go through the pathophysiology of sciatica. It's a compression mainly caused by the compression of lumbar nerves L4, L5, or the sacral nerves S1, S2, or S3. or the compression of sciatic nerve itself as it runs down. When sciatica is caused by the compression of a dorsal nerve root, it's also called as radix. Radix nervi is the emerging nerve root. It is considered a lumbar radiculopathy. So radiculopathy is a condition due to a compressed nerve in the spine that can cause pain, numbness, tingling or weakness along the course of the nerve, and it can occur any part. Radiculopathy can occur any part of spine. So here it is the sciatic nerve roots. It's also called as a pinched nerve. Pinching of the nerve root in the spinal column. It produces a range of symptoms. And it can occur as a result of spinal disc bulge, that is a herniated intervertebral disc, or misalignment of the vertebrae, that is spondylolisthesis, or as a result of degenerated disc. So degeneration can occur due to osteoarthritis or conditions like that can reduce the diameter of the lateral foramen through which the nerve exits. So these are the reasons why the nerve gets compressed in its course. So you might have learned the basic anatomy of the intervertebral disc. And the intervertebral disc consists of an annulus fibrosus. There is a ring surrounding the inner nucleus pulposus. So when there is a tear in the annulus fibrosus, the nucleus pulposus or the pulp that is inside, it may extrude through the tear and it press against the spinal nerves within the spinal cord. So you can see in the diagram, or the cauda equina region or the exiting nerve root. So it causes inflammation, numbness, or a kind of excruciating pain, that is severe pain. So this extruded liquid from the nucleus pulposus, it may cause inflammation and swelling of the surrounding tissue, which may cause further compression of the nerve root in the confined space in the spinal canal. So totally, a bulging disc, it can produce sciatica syndrome, or an inflamed joint, or a muscle spasm, that is piriformis muscle that I've told earlier. So all this can produce sciatica. I will just go through the symptoms of sciatica. That is, cramping sensation in the thigh is present, a radiating pain from the lumbosacral area or the buttocks region down to the back of the leg. There is tingling sensation in the leg, and numbness is seen. Burning sensation is seen in the leg or thigh area. Then severe cases, it presents with muscle weakness, and fasciculations might be there. And usually it is unilaterally, unless there is a bilateral disc involvement. In that cases, it can be bilateral also. Now we'll come to the investigations which are required to diagnose the condition. That is, the nerve conduction velocity studies can be done, or electromyography, to examine how well the electrical impulses travel through the sciatic nerve. Then radiography, it's a common investigation, but mostly the radiographs is seen normal unless there is a structural abnormality or severe degeneration is present. So loss of the normal lumbar lordosis. So lumbar area has a normal lordosis. When it is lost, as in case of bamboo spine, etc. So in ankylosing spondylosis. So in such cases, there is a loss of lumbar lordosis can be seen, or scoliosis is present, and there is a reduced intervertebral disc space due to some reasons, or a bony spur, it can be seen. So all these cases can be seen, which might be a reason for the nerve root impingement. Then CT, again computerized tomography, that is the morphological abnormalities in relation to the herniated disc can be very well appreciated, and it can be used to check the adjacent soft tissues or any neuroforaminal or extraforaminal encroachment by some, if there any growth is extra is present inside the foramen or outside the vertebral foramen. So all this can be found out in CT. Then myelogram is using a dye. It's a dye injected between the vertebrae, and CT is taken, and it can determine if any spinal stenosis or any narrowing is present. Then MRI, it's the most appreciated choice. The detailed images of the bone and soft tissues such as herniated disc can be studied in detail in case of MRI or magnetic resonance imaging. Now we'll see few tests which are required to diagnose it clinically. That is clinical examination of sciatica. Usually the main test for this is the straight leg raising test. It's also called as Lasik sign. So if it is positive, that means it is sciatica, or there is another root irritation which is leading to the radicular or the radiating pain towards the foot. So patient is made to lie in the supine position as seen in the picture, and the leg is lifted gradually with the knee in extended position. So it can be done actively or passively. Passively in the sense we give a support to the leg, and actively the patient itself can raise the foot. So between 30 and 70 degrees, so we have to note the degrees of when the pain begins. So between 30 degree and 70 degree as seen in the diagram, usually the nerve, it comes to contact with the prolapsed discs. So that is the angle at which the nerve comes in contact with the nerve root comes in contact with the prolapsed disc, and patient complains of the pain. So anywhere between 30 or 40 degree up to 60 degree or 65 degree, it indicates the nerve root impingement. So more, if the patient is having pain more than 70 degree only, then it indicates some other issue other than this nerve root irritation, that is joint issues, can be present. So this is the straight leg raising test, and it's very important test to clinically assess the sciatica. So another test is Lasik's test. It's almost similar. Lasik test. It was done actually. It's for confirming the sciatic nerve involvement with other problems like hamstring tightness or any other sacroiliac joint lesions. So we by doing this test, we can confirm that there is a nerve root involvement rather than a hamstring stride tightness or any other space occupying lesions which is producing this similar radiating pain like sciatica. So we have to do the SLR and flex the hip to 90 degree and flex the knee. So here we have to flex the knee in the supine position and flex the hip. So you can see in the picture. And then after that, you can passively or with support. So you can see the doctor has given the support to the heel, and he is extending the knee. So afterwards, so when he extends the knees, if it reproduces the radicular symptoms or the radiating pain in the same leg, it indicates a positive Lasik test or involvement of a nerve root. So this is used to rule out hamstring tightness. Then the same pain due to hamstring tightness or any structural deformities or any structural mass occupying lesions in the lumbosacral or sacroiliac area. So we can confirm that there is a nerve root involvement present here. So another test it is the Bragard sign. It's also a follow-up test to the SLR. It is used to evaluate the lumbar disc herniation and sciatic nerve involvement. Again, same. So we can confirm whether there is a nerve root involvement. So all these are confirmatory to show the presence of a nerve root involvement. And you have to perform a straight leg raise passively with support. And if SLR is positive, so say at 40 degree SLR became positive, and then you have to lower the leg below the point of pain to reduce the symptoms. Say 5 to 10 degree lower, you are reducing the leg, lowering the leg, and the pain and the symptoms release. So at that time, if you passively dorsiflex the ankle, you can see the picture, there's the arrow, direction of the arrow, you catch the foot and dorsiflex it towards the body. This test is positive if it reproduces the patient's pain on dorsiflexing of the foot. So again that indicates stretching or the irritation in the nerve root. So Packard sign is also a follow-up test or confirmatory to SLR. And again one more point is there, you can also ask the patient to flex his neck. It is called a Soto Hall test. Again it also elicits pain in the leg. So another test is a bowstring test. Again, this is to confirm the nerve root irritation. You have to perform the SLR test passively and ask the patient to flex the knee to reduce the symptoms. Say at a 45 degree the person got the pain and he is asked to flex the knee. Then by flexing the knee the nerves get relaxed and the symptoms are reduced. At that time you have to apply finger pressure on the popliteal fossa, through which the branches of the nerve passes and through the popliteal fossa, and you have to put pressure on that area, and this will bring the symptoms back. That indicates sciatic nerve compression. Again, this is also a confirmatory test for sciatica. And one more test is there that is called as crossed SLR. Because this is also confirmatory. Increased sciatica on raising the opposite or the well leg. So here what we do is that the person is having a pain in the left leg, or there is a herniation in the left side, and we are using to do the SLR. The SLR is performed in the right leg or the normal leg, and it's associated, and the pain is produced in the left leg, affected leg, on doing the SLR on the normal leg. So this is called as crossed SLR. It is associated with herniated lumbar disc in 97% of the patients. The examiner will passively flex the patient's uninvolved hip while maintaining the knee in the full extension. This SLR is performed, and passively we are keeping on flexing the normal hip. And a positive test is considered when the patient reports reproduction of pain in the involved limb at 40 degrees of hip flexion or less in the uninvolved limb. So in the right side, so the patient is having pain in the left side. So the right side we are doing the SLR and we are keeping on flexing the hip, and at 40 degrees, so you have to note the degree at which the person complains of pain. So when we passively flex the hip of the right, when it reaches 40 degrees or more, the patient complains of pain in the left side. That shows the involvement of the nerve roots. It is transmitted. The compression, it is where it is normal, whether it is normal, usually it is normal in the right leg, but when it flexes, the nerve root stretches, and as the left side there is a disc herniation, the pain is reproduced. So the examiner should make note of the degree of hip flexion where the patient reported pain or reproduction of the symptoms. So you always have to mention about the degrees. So whenever you write SLR, the answer should be is positive at 30 degrees or at 40 degrees, at 50 degrees. So that should be the findings of a positive SLR case.